Hello, hello, hello. What is going on? You are watching and, of course, listening to Tags Live, aka Talk About Gay Sex, the live edition. This is episode 511. We are in front of a virtual audience. This is live. And, of course, we're having a little bit of technical difficulties with our co-host, Kodi. Trying to figure it all out, but we figured I have my phone opened, so he's going to update me, but he will get it together. On this episode, we are really excited, and a little bit later on the show, to bring on our special guest, Chris Bustamante. He is we call him Dr. Chris Bustamante, and he is a nurse practitioner, and he's got all of these new things for our sexual wellness that are really exciting, that you want to hear about these things. They are going to change the sex game and really be great for us. So stay tuned for that coming up a little bit later in the show. And we are so excited for our brand new podcast that dropped today, y'all. And I'm talking about Of a Certain Age podcast, or OACA, OACA. Super excited about this brand new podcast. It is just dropped, and we had a couple of viewer responses already that people wanted to share, starting with on YouTube, because actually the show got dropped a day early on YouTube, and I know some people saw it. Ben Connolly commented, "There's nothing more sad in life than a human being in a job they don't want to do, or the feeling, I hate this job, but I don't know what I want to do next." So that was in response to our special guest on the premiere episode of A Certain Age. Nathan was our special guest, and he is a life coach. And we asked the question, are you where you thought you would be? And some really good insight into this. We divulge a lot, and somebody else that watches us on YouTube commented, "Love hearing you guys speak on deeper topics. Can't wait to see what you come up with in future episodes." And then I just had a friend of mine, I should read it to you. She loves the concept, the prelude, and the tone that both of us bring to the show. It sounds familiar, but yet new with a new twist. So thank you to my friend Shawnette and Kodi.
Woo! Stressful. Hello, darlings.
Stressful trying to do the show with when you plan on doing it with your co-host. Not Kodi. Welcome to Tags Live, Kodi.
I mean, at least I look gorgeous, right?
I felt like I was doing a little bit of like a dog and pony show. Da, 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 da. I was about to do my old stripper moments. I don't think anybody would want to see that.
Girl,
but I don't want to see that.
You know what? I'm going to log back out. You can do it. Do it for me, okay?
Please do not leave me. It's one thing when you're doing a solo gig, but when you we do truth be told, little behind the scenes, we do a production meeting for this particular show, especially when we have guests, and it's all planned to be back and forth, right?
Yeah,
so,
of course.
Oh my goodness, thank you. I'm so glad to see your face. I've never been more happy
to be here.
To see you.
Bitch, wait a minute now.
Let me just adjust my computer because it was set for the other version. Okay, good.
Okay.
Everyone loves your haircut.
Oh, thank you, guys. Thank you, guys.
Yes. We've got some hot topics to get into, but I think let's skip some of them because in about 10 minutes, we're going to bring on our special guest. But one of the things I was telling our audience is that we are so excited for Of a Certain Age, that podcast that dropped today. And what's been this experience like for you with this new show? Because it's totally different from Tag's podcast.
Yeah, it's so amazing. I love being able to talk to people and getting their viewpoints, not only about on life, but their experiences and things that motivate them. It's just so enriching. So I've really enjoyed myself. The format is so amazing to me. It's we get to see people of all walks of lives and we interview them, but we get to put our own little perspectives in there as well. So it's been so great.
Yeah, I think one of the great things about it is the format, like you said, is totally different. This show that we do here is based on hot topics, hot LGBTQ plus topics, hot sex topics. We often have guests that we are prepping right before the show. The difference for this newer show of a certain age that's available wherever you get your podcasts out now is that, first of all, it was a labor of love. I think we started at the beginning of all summer long, we were recording because it's not time sensitive, although it is about aging. So we want to get this out, but it's not it's not time sensitive in a way that has to do with hot topics wise. And so my sister commented on it and she said, wow, even the tone that both you and Kodi bring to the show is a little bit different and a little bit more subdued. But because we're talking a little bit more about life and life issues. And so we can be deep when we want to be deep, when we're not on our knees or in the back alley.
This is us getting our grown man on for sure. So thank you. Thank you, everybody.
While we have everyone's attention on our brand new show, it will drop every Wednesday wherever you get your podcasts: Spotify, Apple Podcasts, iHeartRadio, all of them, Amazon Music. It's all available. Of a Certain Age, the acronym OACA. You can look it up, but one of the things that's exciting that we could tell everybody is the theme song of a Certain Age is sung by our very own Kodi Maurice Doggette, and that's the title track of A Certain Age, and it's so good. What was that like singing that and writing it?
It was amazing. Writing it, I love writing. I want to write all the time for everybody, all the time. So if you need a song, come my way. I'd like to be deep and introspective with my musical writing, and I think that it was really great to really connect with the message of the podcast. So that part, and it touched me in ways that I didn't think that it would touch me, because I wrote it about myself, kind of honestly, because I'm just still discovering myself in my grown age, my big age. So that was all part of it. It was such a cathartic thing, and singing it was, girl, it was fun. It was good though.
This has truly been a labor of love putting this out. It's been in segments, and we are still working on it. But it's so fun to finally see it out, and we're learning and growing with the guests that we have on this show. We're sharing our process of aging, and I think the whole point is, and our tagline is living out loud. We really wanted to find the tools through guests, through our own shared experiences, to navigate ways to really embrace life and pivot, and to have some newer ways of looking at the aging process. It doesn't have to be dour and solemn. You can be grabbing life by the balls, and we won't say that on that show, but we can say it on this show.
Here, though. Yeah.
And so it's really exciting. Of a Certain Age podcast, OACA, OACA is how we say it. Wherever you get your podcasts. The first episode is out now, including YouTube. Download it, subscribe. We would love this audience to find out about it and listen to it. What are some of the people saying?
They are commenting on your succulent lips, and I love that.
My succulent lips.
I love it. They said they want to see an Of a Certain Age OnlyFans.
We could do that. Yeah, we're talking about intimacy on that show too. So
yeah, that could be behind the scenes After Dark type deal. Ooh, Tags After Dark and Of a Certain Age OACA After Dark. Wonderful. And they said the music. They're so proud of me. So wonderful.
I love it.
Yay.
Very cool. Good evening. We've had a technical difficulty today, but we dropped our brand new show of a certain age. And you're on that new show, Chris Bustamante, Dr. Chris Bustamante. We should at least announce his name. Dr. Injector Chris has just joined the show. Thank you so much. We have so many questions for you. But we were just talking about our brand new show of a certain age, and you are one of the guests that will be coming up in, I believe it's December, Kodi, right? That he's his episode, and so you'll get to hear him on that show. But on this episode, we have so many things. Dr. Chris Bustamante has Lushful Aesthetics, and we're going to be talking about sexual enhancement, confidence by some of the treatments that he offers. First of all, how you doing? Did you have a busy day? What's going on?
I did. I worked 8 to 8, so I'd call that pretty busy.
Yeah.
Well, you look fabulous, so
thank you.
You're doing something
home,
right.
Changed and comfortable. Yeah.
Okay, nice. I love it. Do you drink because at all? I'm just curious.
Like, do I drink alcohol? Is that what you're asking?
Yeah.
Yeah. I'm actually not like a huge drinker. I drink like once a week, but I do love me like an espresso martini.
Ooh.
How bad is alcohol for our skin? Just be honest.
I mean, listen, everything in moderation, right? I think the reality is like if you are drinking more than like 2 glasses a night, you're probably going to have more dehydrated skin. If you're just drinking 2-3 times a week, then
I got my water bottle next to my cocktail.
Right? It's all about balance, whatever.
Okay,
but the reality is also that it's a huge misconception too, with people like always saying like, "Oh, my skin looks really good because I drink so much water." Well, your skin is actually the last organ to get that water, so water consumption really doesn't have a huge role in like how your skin really looks. Like, yes, like overall like wellness does play a role into how you present, but most things that you see on your skin is going to benefit more from like topical ingredients, whether it's just like, daily application of sunscreen, right, is the number one thing you can do to be preventive of aging. It doesn't have to be anything expensive. It can just literally be sunscreen every single day, and you'll see such a huge difference in how you age, because the sun is the number one source of aging. But then even just after that, like general moisturizing, using a daily retinol, those are all very affordable ways to look your best. And they're way more effective than having to always like be feeling like you need to chug down all this water, which is not actually true. I mean, yes, we do need water, but I see people all the time like, "Oh, I have to drink like 10 glasses of water a day for my skin." And I was like, you don't really need that, but whatever you want to do.
That's such good advice. I remember Cameron Diaz came out with a book a year ago or so, and she was like, she drank, it was like a gallon of water every single morning. And I tried that, of course, because Cameron Diaz did it. And it was like, I could barely get through a quarter of it before I was like, I need my coffee.
Well, maybe she had to do that because she started out with this new wine line that she has now.
So she gave up.
Maybe she has to drink that gallon of water to make up for the wine she had the night before.
I think that's a fair trade-off. A gallon of wine and a gallon of water. I think Jesus did it.
Actually, I tried the wine. It's actually really good.
Yeah?
Okay. And I tried Sarah Jessica Parker's wine, and it's really good too.
Yeah, okay. I mean, maybe they know what they're talking about. But yeah, Cameron Diaz's wine, I liked it. And it's the whole thing is that it's like not high in sugar, which is also something that definitely like contributes a lot to hangovers. So like I'm 31 now, and I can say that in the last 2 years, like, oh boy, does alcohol really do a number on a hangover for me. So that's one of the reasons why I don't drink regularly. But I noticed that when I drank that wine, I did not feel the same intensity the following day.
Interesting.
So, yeah.
Well, before we get into some of these, I know I was looking on your website. We're going to go through some of the treatments that you offer. And I did notice, actually, speaking of alcohol, that if you're going to go for some of these procedures, because alcohol can thin your blood, I believe, it's not recommended to be drinking, like if you're going to go for some treatment of some sort, correct?
Yeah, I wouldn't do like, a crazy banger the night before going in for injectables, right? If someone had a glass of wine, it's not going to be, a terrible thing. But like there are some people, like I said, like they're going out crazy, and the next day they want to go get injected, and then they want to be surprised why they got a bruise.
What is this, the 80s? I mean,
it's just the nature of the beast, so limit, blood thinning, ingredients like alcohol, ibuprofen, aspirin. Caffeine is a big one as well. I would not recommend drinking a coffee before going to get injected. You're actually going to be in more pain because you're going to be more like in a vigilant state because like it's a stimulant, right? So you're going to feel more, but you're also going to bleed more as well. So it's just not recommended. But that being said, like it's not like a contraindication. Like you still definitely can do it. I mean, if I wasn't injecting people who didn't drink a cup of coffee that day, I mean, I wouldn't be able to inject anyone because everyone drinks their cup of coffee in the morning. But for my people who are more sensitive or just really nervous about getting bruised, then I'm like, then just skip it.
Yeah.
Got it. Well, we're going to
Put
round
me to
robin
sleep
it.
anyway, right? No?
Yeah.
We're going to round robin it, and I'll start with one of the first treatments that you offer that I'm so curious about for our sexual enhancement. And the first one I was reading about is Serotox, and then we could talk about Hungtox. One of them is they're both for your penis, and
I think you're talking about Showtox and Hangtox, right?
Yeah, sorry, Showtox.
Okay.
Thank you. Yeah, can you explain those?
Absolutely. So I kind of break up. I think the easiest way for me to explain like our sexual enhancement procedures is kind of like categorizing them. So I have procedures that are more for sexual enhancement in regards to performance. I have procedures that are kind of a little bit of performance, a little bit of aesthetic, and I have some procedures that are strictly aesthetic. So starting off with, you know, the more sexual enhancement performance aspect, that is more shockwave therapy and the P-shot. That's all about functionality, giving you harder, firmer erections and better sensation. Shockwave therapy is used off-label here in the US, but is on-label in some countries in Europe. It's originated in orthopedics, so using for more like muscular and joint issues. And shockwave therapy strategically damages tissue at a micro level, something that you don't notice or feel. It's actually not a painful procedure at all. It actually kind of feels like a nice massage. And so those micro damages that it releases tells your body to facilitate the healing cascade. When your body heals, our body requires blood supply to heal anything. That's why bone heals so well and why cartilage heals so poorly, because it's all based on blood supply. So during that healing process, your penis gets more vasculature and helps to repair some of the nerves there as well. So you are getting more sensation with each treatment. You're getting harder, firmer erections with each treatment. And then I combine that with the P-shot, which is when I draw your blood, spin it in my double spin centrifuge, extract all the growth factors and stem cells from your own body, and I inject that back into the penis. That helps stimulate harder and firmer erections. So that's more of a regenerative medicine procedure that I offer. That is all you, it's all natural. There's nothing additional. That being said, it does not make you bigger, right? Some guys are like, oh, I want enhancement. It does not make you bigger. I don't promote it as such. Some people will say they feel bigger, but I really just think that, having done that on myself as well, you are just harder. So it's one of those things like, when you feel like you're really engorged, it looks bigger, but you're not actually bigger. So I don't promote it as that.
Is it fair to say that the blood supply is reaching your penis quicker, and so you're getting more sensation because of that blood supply? That's why you're seeing firmer, harder erections?
It's a better blood supply and also improved sensation. You'll notice that you'll have more spontaneous erections. When you go to engage in sex, you'll notice you'll probably get harder faster. When you are hard, the quality of the erection itself is harder. Right. So all those things, kind of like if you've ever taken a Cialis or Viagra, right? Like we know that that's like a really nice firm erection. And so this kind of mimics that, but without the pill. That being said, it's not forever, right? It is regenerative medicine. It kind of results slowly fade away over the course of a year. But it is really nice because it's kind of this more spontaneous thing. And it's in some way you can kind of think of it as being good for your body because it is just all regenerative medicine and there's no downside to it. Extremely safe and effective. And it's one of those things that it could be very fun. I mean, I have a lot of guys in their 30s doing this, and it's not because they have ED, but it's more so it's like, I think that in your 30s is when you start to recognize that you're no longer 18, right? Things are like, things are not the same exact, right? Things are not the same thing as they once were, but things still work very well, right? In your 30s. And then as it kind of goes further along, we notice more and more changes. But this procedure is really great for people who have mild to moderate ED or just looking for a performance enhancement. It's not for people who do have severe ED, then they would probably need to see a urologist for more higher intervention.
And I know,
Yeah,
Kodi, you
so,
have a
okay.
question, but
I do.
we're live, so I just opened up my chat window. So if anybody has questions, well, Dr. Chris Bustamante's live on our show, please put them in the chat, and we will try and get to many of your questions. But go, Kodi.
So for me, the way that I'm understanding it, it's kind of like you're turning back the clock because it's stem cells, correct? So it's like turning back the clock on your penis, basically.
Yeah. And it's stem cells from your own body, right? So they're also not being introduced from a foreign place, which is also not bad either. But people sometimes like to know that this is entirely like natural, essentially.
Beautiful.
You mentioned
I love
something. You mentioned something that it's approved in other countries. Is it not approved here yet, and why? And should we be concerned about that?
I wouldn't be concerned because most things in medicine are often used off-label. Because on-label indications are really difficult to receive. So when you, for example, so like Botox itself, right, has 11 approved indications. It's used for a lot more, but Botox has been around for 22 years. And so it's received those 11 indications over several years as more studies have been put into it. You have to submit several studies to the FDA in order to, and that which requires lots of money, right? To get those things approved in order to say like, oh, this is the treatment for this condition. So, and then the FDA says, based on these studies, whatever it is, yes, like we've confirmed that that is the treatment for this condition. But there was plenty of doctors that were trying and using Botox, let's say for migraines, which is now an indication, right? Before it was ever approved, because you have to understand what the medication does, what it's for, dosing, therapeutic, and you have to kind of like, you know, trial and error, but you know what these things do, and that's what you're acting on. So it's the same concept, right? So all aspects of medicine, you're utilizing different types of medications for off-label usage because you know how those medications work, you know how those things react, and that's what you're doing. So in this case, it's not a medication, it's a device that we're utilizing that we know works on tissue repair, you know, in an orthopedic world, that someone was like, okay, what if we dial that down and lower the setting? Can we use it on a urological perspective? And so that's what people have been doing. So you will see urologists, you know, across the country utilizing shockwave therapy for erectile enhancement and performance enhancement. But it just is not like, oh my God, the FDA has like said that this is the go-to thing for it just yet. So it'll take more backing from eventually one of these device companies to host a huge trial, which will cost them a lot of money, to then submit that trial to the FDA, because that's just kind of how things work, you know?
Okay, beautiful. And going back to Showtox and Hungtox, how do the procedures that we talked about before, how do they differ from Showtox and Hungtox?
Yeah, so those are my trademark procedures. And that's kind of where the next step is, like kind of in the middle between like functionality and also aesthetics. So for those procedures, I'm using Botox off-label and I'm injecting it into the penis. That's my Showtox procedure. Takes you from being more of a grower to a shower, right? Because 80% of men identify as being growers and not showers, and so they feel like, yeah, that's most people, 80% of men, right?
I read that and I was like, oh my God, this is so good. Real quick, what's off-label?
Off-label means that it's not the indication the medication was originally passed for.
Oh, got it. Okay.
That's what it means. Yeah. Which again is most things, right? We use most medications out there are being used in some form off-label. Okay. But that means the medication itself was passed and is FDA approved for something else. Yeah.
Ozempic or whatever that's.
Yeah, exactly, right? So Ozempic is a great one. So it's on label for diabetes, and was being used off label for weight loss, right?
Got it.
So there you go. But yeah, so I'm using Botox on the penis for Showtox. And so what that does is that the penis has two spongy tissues that run along the shaft. And so that's called the corpus cavernosum. There's a thin sheet of muscle that surrounds that tissue. And so by injecting Botox into the corpus cavernosum, it reaches that muscle. It relaxes that muscle so that when you no longer have that pull, that really tight pull when you're flaccid, it allows you to flop around and hang more when you are flaccid. And now the performance aspect of that, the kind of duality of it, is that when you do get erect, you're able to kind of accommodate a little bit more blood because that muscle's relaxed. It allows it to kind of fill a little bit more. So patients will also notice that they get harder and firmer erections while that's also active. Now for Hungtox, that is my procedure that everyone's heard of Serotox. Serotox is trademarked by someone else, so I had to trademark my own thing, but it's essentially that. Hungtox is for the scrotum. It relaxes the muscle that we have, that reflex that pulls up our testicles when we are cold or nervous. And so by relaxing that muscle in our relaxed state, we get to hang more. So both of these procedures combined together kind of just allows our junk to move around more, just more comfortable, it's more sexy. And then you do have that more functionality perspective too, is when you are hard, you kind of notice harder firmer erections.
I love that you're doing this because I go to the Naked Beach every summer in New Jersey. And, while I am what am I, Kodi? A shower, not a grower? I don't know.
You're a grower, not a shower.
A grower, not a shower.
But you don't need the Hungtox though, because
oh yeah, he saw it this summer, I guess. Yeah, they're naturally hanging, I guess, of a certain age. Wink, wink. Plug for our show. But yeah, I just think it's so great that these procedures are out there, because it's almost like the rooster back in the day, like these techniques to kind of show your stuff ahead of having fun. And I just love that these things exist now. It's so cool.
Yeah, and it's so funny because it's like, obviously I do tons of things facially for men. My practice is over 95% men. And there are some guys who will dabble with, face and sexual enhancement procedures, but then there's some people who just stick to face stuff and some people who just stick to sexual enhancement stuff. And they, everyone has their own things that they like. And so it's always so reassuring when people come in and they're exploring all these sexual enhancement procedures, and they're just like, and they're not like insecure guys. It's just like they're guys who are just like, this is so fun, and I'm happy that something like this exists. Because it just changes, our sex lives, and it kind of just like revamps it in its own way. And it's fun to experiment. It's not forever. You don't have to keep doing it if you don't want to. You can stop whenever you want. But sometimes it's kind of just fun to do something different, right?
Well, you've definitely got the accolades and the intention, and people are coming in. You're based in New York, and it sounds like as a gay man, you know what we're looking for and what aesthetics, and you've really taken the time to. You've even worked on porn stars like Boomer Banks, who's one of your subjects, who we all know and love. He was on our show, Tag's podcast, before. And so the word is getting out. So I'm really happy about it. But Kodi, did you want to say something about working with Boomer?
Oh, go. Please tell me all about it.
What can you tell us besides it's fun to work with him?
Wait, what was the question?
Working with Boomer Banks.
Oh, he's fabulous. I mean, I've known Boomer for a couple of years now. He's fantastic. He's such a nice guy. And yeah, I mean, I have nothing else to say. He's awesome. I mean, I see him all the time. So
love it.
Yeah.
Well, I'm trying to attract Boomer Banks, so I need to know a little bit more about the Instant BBL, because I've recently just lost some weight, and it seems that's where I lose my weight, in my butt, basically. So how do I get that back there? Can you tell me? Sir Mix-a-Lot would be very disappointed in me because I've lost my butt and it's not okay. How do I get it back? Tell me.
Yeah, so the Instant BBL is like one of my most popular procedures. It's funny because like when I first started doing it, people weren't really sure like how men were going to react to that, like because it was always traditionally like being showcased towards women. Funny enough, like I have so many straight men that also come in for the Instant BBL, and a lot of them are like lifters, like guys who work out,
bodybuilders,
and they're like, yeah. I have so many of them, and they're just like, I'm able to build so much of my body, and for some reason I cannot build up my glutes, and it does not match the rest of me. And I'm like, oh, okay. So I was like, that is a huge, demographic. But of course, the gays want their butt to look good too. And so the Instant BBL, I'm utilizing hyperdilute Radiesse. Radiesse is a filler that is both a filler and a biostimulator. So traditionally, Radiesse on label is utilized for jawlines. It's very firm. It's very robust. It gives you a really beautiful, crisp jawline. So I use it all the time for that. Off label, I basically mix it with saline to soften it and to dilute it. And then I inject several syringes at one time through one port into the butt in the subcutaneous fatty layer. and that fills up the butt really nicely, gives you an instant result with filler, but also the Radiesse over the next 3 months stimulates your body's own collagen and your own elastin to further enhance the volume, strengthens the quality of the skin, improves cellulite and texture, and makes the skin nice and tight and taut. So it's a procedure that has really great longevity to it because it does slowly fade away over 3 years. It's not something that's just going to disappear in like a year. So it does have longevity to it. It's very buildable. You can touch it up or add to it whenever you want to. I have patients that have had like over 200 syringes put into their butt. But typically I start off with anywhere between 40 to 60 syringes. It sounds like a lot. For the face, that would be absurd. For the butt, it is just not the same thing. Butts are huge when we're comparing them to faces in regards to quantity of filler. So it's just a totally different world. I do 40 to 60 syringes initially for the first treatment. You see a really nice pop, a really nice difference. I really showcase all my work on my social of healed before and afters. It's something that's not a lot of people do that. I don't like to mislead people. I'm really about setting right intentions. And so I bring back all my patients at least 2 weeks after their treatment to take their after shots. So they're not just showing you like a swollen result, because some people will take before and afters of instant BBLs immediately after the procedure, which is very misleading because they look a lot bigger right away than they do when it's fully settled. Because a lot of what you're injecting in there is just saline, because that's what you dilute the product with. But that saline gets absorbed by your body and you can pee it out in the first 24 hours. So a lot of that volume goes down right away because it's just saline. So what you're left behind with is that filler. So a lot of people trick people and they show them these results that they are like, oh, the bandages are still in the patient. Don't believe those, because that is still like with saline in their butt. So I'm always about posting like authentic, like healed results. So, the instant BBL is fantastic. Looks scary, but it's not. It's actually very much like very comfortable. I always tell people, I'm like, lip filler is like way worse than doing your butt. Very easy recovery. You're back in the gym in 2 days. It's easy.
Oh, all right.
Yeah.
Okay. Well, we have a question from the audience, but before that, you mentioned saline, correct?
Yeah.
And I was just curious because you were talking about Hungtox for making your balls a little bit lower. A lot of guys I've seen are injecting their balls with, is it silicone or saline, to make them so plump? And I was just curious what you think about that procedure.
Yeah, I've seen both. There are definitely guys who are injecting silicone into their scrotum, into the skin. I don't recommend injecting silicone anywhere. It can be easily rejected by your body, and if it is, then you'll have to get it surgically excised. Can cause really bad systemic infections, and you just don't know where that product's coming from. So definitely do not recommend doing that. And a lot of times, there's no healthcare professionals that are injecting silicone into people, so that's all being done by self-injectors or people going to someone who's not a licensed professional. So you also have to question a lot of other things, where that product's actually coming from, sterility of the situation, all those things. When it comes to the saline thing, again, no medical professional is actually doing that to someone, so it's being done by someone by themselves or by a friend or whatever it is, so I cannot endorse it. That being said, I guess technically speaking, if you are, getting medical grade saline and you are doing it in a reasonable way, then I suppose it can be done. But I can't obviously back it. It's just one of those things that I can't back people doing these medical procedures with non-medical providers.
Yeah, definitely not going to do it.
You don't want to jeopardize your health, because these things do happen, and there's lots of really scary situations out there. So I would just say avoid at all costs.
Okay, and then we have a question from a listener watching us live right now. He says, Dr. C, can you talk about the high quality of your P-shot technique?
Yeah, actually, that's really important. So I always tell people all the time, whenever they see me or they're consulting or they ask me questions on social, I do have a lot of people that travel in to see me, especially for things like penis filler, which we can talk about after. But for P-shot, another thing that I tell people to look out for is that you want to make sure whoever's treating you for P-shot is using a double spin centrifuge. So most practices just use a traditional one spin centrifuge, and the reality is just because they're a lot cheaper. And so are the kits that you draw your blood in for them. They're a lot cheaper than using for a double spin. They're actually probably like a third of the cost. So it's a huge margin difference, right? And patients don't know that. So like if I charge like, I don't know, 1,800 for a P shot, and someone else charges 1,800, but they're using a single spin, they're making so much more money off of that than I am from using a double spin, right? But the reality is that the amount of stem cells extracted from your own blood it's extremely different. So for my P shots, I extract 120 mLs of blood from you, and I convert that down to 14 mLs of PRP. So it's a huge conversion, right? 120 to 14 is a huge conversion. It's very concentrated. If someone's doing a single spin centrifuge, they might draw up like 30 mLs of blood from you and convert it down to 14. So that's a really low conversion, right? Because it's one spin, and they basically just took like half of your blood, turned half of it, they took your blood and half of it turned into PRP. It's a really weak conversion, really low in stem cells and platelets. So that's not going to give you any like results. And that's why some of these places will tell you like, oh, you need 3 P shots in a row to get the results. And I'm like, what? That shouldn't be like that. Like that's ridiculous. So for me, it's like whenever you're using a double spin, you're getting all of that in one shot. So that's what you're getting. So whenever you're looking for a provider to get P shot or shockwave therapy, the shockwave device needs to be a focused shockwave device and not a radial pressure device. A lot of people will be advertising radial shockwave devices, which is not a real thing. So if it's a radial shockwave device, skip that. It's basically just a glorified massage gun. And so it's always cost, right? Radial shockwave devices are used more in physical therapy, and those run, 18 grand. A focused shockwave device runs 50 grand. So very different for these practices, right? And then they just take advantage of people. And so P shots, you always want a double spin centrifuge.
Love it. Okay.
Fabulous.
I have questions, but Kodi, do you have one? Because
there's one.
Oh, go ahead.
Bryce has a question. He says, Dr. C, is it true that men can have a consecutive orgasm? For example, when I climax, I feel like there could be a second orgasm somewhere in there, but it dies right away before. Is this only gay lore? Thank you.
Oh yeah, there's men who can have multiple orgasms. I personally have seen it, and I've also specified that like everyone's body is different. It has to do with like the refractory period, right? That's what we call it after you ejaculate and after you have an orgasm. So the longer your refractory period, the longer you need to wait before you're able to have another orgasm. The shorter your refractory period, the less time that you need to wait to have an orgasm. So some people, if they keep going, they can just have multiple orgasms right after each other. So you do see that in some men, but obviously we know that it's not as common as we see it in like women, right? Women have a lot shorter refractory periods. Usually it takes them a lot longer to have an orgasm, but typically once they have an orgasm, it's easier for them to have multiple orgasms. But it just varies on the person. It's obviously something you need to kind of like explore with yourself, I think, first before, trying to explore with others. And you can kind of see like what it is that works for you if that's something you're trying to do is have multiple orgasms.
Let's talk penis enhancement and some of the procedures. And recently on our show, we've been talking about how a lot of guys actually don't want huge monster penises. In fact, there's a Reddit thread out there right now that is calling it, what did we call it, Kodi? Or what were they calling it?
It was calling it small dick fall.
Penis fall. Penis
Oh,
fall.
okay.
Or if it's hot girl summer, penis fall is all about wearing larger sweats and finding a boyfriend, because the reality is in this Twitter thread of gay men is that to get fucked every day or weekly from your boyfriend, it can't be monster cock. It needs to be like of a certain size. And so, well, I looked at some of your procedures. One of them I really liked because it was more about the girth versus the size, because we did another story recently where, the anal cavity is only so big. So when you hit that prostate, if you're too big, you're actually pushing too far and it's not even pleasurable. But girth is really pleasurable. And can you talk about some of the procedures that work on actual girth versus, say, size?
Yeah. So penis filler is one of my most popular procedures. I do this procedure daily, and so we utilize this is
Daily.
yeah. It's my fastest growing procedure. So for this procedure, we utilize filler into the penis, and so it's done very differently than P-shot. Where P-shot, I'm injecting. I don't know if you can see, like, if everyone can see me, but with P-shot, you're injecting directly straight perpendicular into the cavernosa because you're trying to deliver those ingredients into the actual erectile tissue, right? For penis filler, that's absolutely not what you're doing. You are injecting filler underneath the skin. And so you're going, in like a straight line, along the sides of the penis. And so that is to widen the penis and to give it more girth, give it more weight, makes it more heavy. So that is a really nice procedure to kind of give you both a girthier penis when you're flaccid and erect. People always ask, how does it look? How does it feel? We do have before and after, so if you're ever curious, you can always email us. We have a portfolio. It does feel very natural to a degree, and then I say that because the bigger you decide to go, right, as some people will keep coming back for more because they just love it. But, the more you add to it, the less natural, I guess, it's going to feel and the less natural it's going to look, right? If you stay very moderate, you are going to look very natural. It's going to feel natural. And it's something that you can feel very confident with, that you can just kind of pass along with as your natural dick and then have fun with it. But everyone has a different mindset and aesthetic around it, because I think that the reality is that penis size is so individualized to people, because it's not always about I need a bigger dick to please my partner, because the reality is that for most people, you don't need a big dick to please them. Most people can do very well with average, right? It's how you use it. But some people, it's the idea and the visual presentation of a large penis that's very exciting to them, right? And a lot of guys also do this, not even for their partner or other or partners. It's because they're like, I just like the way it fucking looks for me. I want this for me. And so it's so many misconceptions about this, where it's like everyone who must be coming for penis filler has a small penis. I'm like, not exactly the case. Most guys are very average. I actually have some guys coming in who are very large naturally, who they're like, fuck it, I want this to be ridiculous. And for them, it's like this shock factor of they already have this huge cock and they want to make it a little bit bigger. And I'm like, all right, cool, let's do it. So
I love that you're extrapolating on this, because one of the common threads that I saw on your website and just in talking to you, you've been on the show before, is you mentioned confidence a lot. And a lot of this is confidence. Confidence is really personal. It's not you do it for yourself first before you project out to the world. We're all projecting out to the world and putting out images and so forth. But I love the word confidence that some of these procedures are giving, and you just extrapolated on it and it makes more sense on how confidence factors into why people get some of these treatments. So I love that.
I mean, I have a lot of guys who will come in who will say that they're like, this is not even for sex. This is for when I go to the nude beach. This is when I'm in a Speedo. This is when I'm in the locker room. And I'm just like, oh, cool. Yeah. And they're like, it's never for them, it's not about the bedroom when they're having sex with their partner or partners or whoever it is they're hooking up with. And then there's people who are the opposite, right? For them, they maybe feel like they never go to a nude beach. They're never changing in a locker room. But for them, it really is about the bedroom and how they feel with other people. And it just really varies from person to person, but it's a very safe procedure, minimal downtime. There is a little bit, swelling and bruising that comes along with it, just like it comes with any other filler procedure. But it's something that lasts a long time, slowly fades away over 3 years. Looks very natural. Again, we have before and afters to showcase, and it's becoming very popular. I estimate that penis filler is going to be what breast woman was for women in the early 2000s. That's what it's going to be. I think
you heard it here first.
Yeah,
I'm going to be busy.
I do think that in the next 10 years that a huge portion of the guys that will have tried penis filler at some point. And I think it's going to be pretty cool, because I think it's going to be more of an open conversation. I have more people I know that are just talking about it. And I think that's pretty exciting, because I think that we are becoming a little bit less judgmental when it comes to aesthetic procedures overall. Let's talk even about Botox, right? It's not so exciting anymore. Yeah. Everyone's always talking about how they're getting it done, right?
Right.
And it's it just becomes this nuanced thing. 15 years ago, no one would ever tell someone they're getting Botox done. 10 years ago, they would never say it. You know what I mean? Even 5 years ago. But now it's everyone's doing a story as they're walking over to get their Botox done. So
we talked about it on our show on episode 510, but we only have so much time, and I really want to get to this one that I think a lot of bottoms are really going to appreciate.
Yeah.
And it's
Yes.
Holetox, I believe. It's anal Botox. And one of the things that I was really struck by is if you get this, a lot of guys that we get writing into us have problems bottoming, taking a large, even any size, and they've just submitted to the fact that maybe they can never bottom. And I know that I was reading Holetox does a little bit of this, relaxes the muscle, but what else does it do, and what's the procedure like?
Yeah, so actually this video is kind of going viral on our social right now. But yeah, Holetox is our trademark procedure for anal Botox. Also, again, anal Botox is not new. There are research studies going back 20 years of people using Botox anally to treat chronic fissures. Because what you're doing is by relaxing that muscle, you're allowing that pressure to be taken off of the muscle so it can actually heal. So that's how it's being done more for like people who have active proctology issues, right?
And can I stop you really quick there? Because several years ago, I had even more serious a fistula. And
that's a tunnel, a fissure that turns into a tunnel.
Yeah, and I saw our mutual friend, Dr. Goldstein, and thank goodness everything's good and repaired there. But, you know, when something like that happens, you're always worried that something could reignite. And so I was really interested in this procedure.
Yeah. So I mean, I learned this from Dr. Goldstein. He's fantastic. He's a pioneer in this field. So I worked in proctology with him. I was with him in the OR.
Wow.
So, yeah, he's fantastic. And so what I'm doing is essentially that. So it's like no longer, you know, he does it outpatient as well. And, you know, he sees patients all the time without surgery, just doing anal Botox, right? And so that's what I do. So I'm treating both the internal sphincter and the external sphincter with toxin, Botox, and we're injecting it to relax the muscle enough where you're able to easier bottoming and more pleasurable bottoming because it's easier. For people also, like, you know, people who have really tight sphincters have sometimes hard time have bowel movements, right?
Yeah.
And so this helps them with that as well. And people always have questions about, like, you know, incontinence, right? Am I going to shit myself? And I'm like,
well,
no.
right.
We're not completely paralyzing the muscle. We're just relaxing it, giving it enough just for you to ease, you know, what you need to do, but you still have control over it. And it's very adjustable in terms of dosing. We do have like a standard therapeutic dose that we'll start with for some, and we always kind of aim obviously a little bit more conservative. But if people are like, oh, I feel like I would use a little bit more, great, we can do a little bit more. It's obviously catered towards the individual. And obviously you do an assessment when you're first putting in the anoscope. You can kind of see how much resistance you're hitting, right? If it's really hard for you to put in this tiny little anoscope, you know that this person probably could benefit from doing a little bit more toxin. If you're able to kind of get the anoscope in pretty well, you know you can just stay conservative and they're going to get a really nice result. But it takes 2 weeks to kick in. It lasts 3 to 4 months. And it's a great procedure for someone who is just getting into bottoming, has had always difficulty bottoming, is looking to take bigger penises, bigger toys bottoming. It's extremely safe. And yeah, people love it.
So you would, excited. I'm sorry, I'm going to jump in.
Kodi. Yeah, jump
in. So you would recommend it for somebody that has had previous issues with their backside, as far as like fistulas and any issues that they've had?
Fissures, fistulas, hemorrhoids, yeah, fantastic for that. So you don't get reoccurrence because it relieves that pressure, right? So whenever you have more pressure back there, more tightness, you're going to be more prone to injury. And so, you know, from the words of Dr. Goldstein, I think that it's said so well. The people who typically really don't need this stuff and who don't really see injuries with are people who bottom regularly. If you're bottoming regularly, you have trained that muscle, you have trained that skin for that friction, for that, you know, for being able to expand. But when you don't do it regularly, it doesn't mean that you're not like a bottom full time, but just maybe if you're not having as frequent of sex per se, right? And you're not really actively, you know, training that muscle, training that skin, you are going to be more prone to injury. It's just the nature of the beast. And so safe sex practices in terms of protecting your hole is not just Holetox, but things of like dialing a little bit before sex, right before you engage, can be really beneficial. because you're kind of going at your own pace a little bit to kind of open up. So even when guys are douching, a recommendation is kind of just like after you douche, before you kind of go and engage with your top, put a small toy in there and kind of, open yourself up a little bit. Yeah, it's going to really help prep you for that engagement. So that's advice before you even have to go see a medical professional, is just trying that out on your own. It doesn't cost you much except for buying a toy that's meant for that, for that area, and just giving it a go. But those are things that you can do to help prevent, injury. And Holetox, what I've done is taking it out of that environment where people are seeing someone because they have an injury, and I'm doing it more for people who want to use it more recreationally, prevent injury.
Yes.
And I do it with give people a little laughing gas to kind of ease the tension back there, so that it's kind of not so that big jolt of oh my god, that was uncomfortable. They're very easy and comfortable. I'm done in 2 minutes. It's done.
Dr. Chris Bustamante, amazing. The science is here and you are just delivering it in so many ways. I'm just so excited where we are at right now. And I just love the science of it. And you're almost like an artist in so many ways, because like you said, you'll always err on conservative treatments, but everyone's going to be different. And so I just think this is a really good time to be a gay man and to have somebody like you. We've got to wrap it up, but how can people follow you? I already put it up, your website, lushaesthetics.com. I know at Injector Chris on Instagram. Where else?
You can follow Lushful Aesthetics on Instagram as well. And you can follow Injector Chris on Twitter and Lushful Aesthetics on Twitter as well. Twitter's where you see the uncensored stuff for a lot of things that we do. So you can kind of get an inside peek of, what that looks like. But if you're also looking for before and afters of penis filler, you can also email us. But yes, we're very active on social. We post all the time. So if you have any questions, feel free to reach out to the office.
Yeah, and before we go really quickly, I know some of these procedures can be a little bit pricey. They're not for everybody, but we talked about it. You're going to be on our upcoming show Of a Certain Age in December, and we talked a little bit more extensively about it, but you can finance with this service called Cherry. Just a quick liner, 10 seconds on that.
Yeah, it's a great no hard credit check financing program. It's not through us personally, it's through this program called Cherry. You apply for it, and you can see how much you're able to borrow. They have really great financing deals. It makes it really cost effective for most people who have normal credit scores. If you have great credit scores, you probably can get no interest at all, and just kind of do a simple payment plan through them.
Dr. Chris Bustamante, thank you so much.
We'll
have you back. You're going to be a regular.
Yeah, absolutely. I'll be in touch with you guys soon. And you guys have to come to the office sometime.
Oh my God, I would love to.
We will.
Yeah,
absolutely.
I'll email you. We'll coordinate. We can do something fun.
All right, cool. I love it. Right. Thanks so much.
Thank you so much. Have a great night.
You too.
Bye.
Oh my God, Kodi.
That was
so much information.
I know, it was so great.
Bryce says, thank you so much watching us live. You are incredible, Dr. C. I love Dr. C. Yeah, so good. Wow. Caladad says, yay, I know. Did you not learn so much today?
I always learn so much talking to him, so thank you so much.
Yes, and this show, by the way, has been a formulation upon formulation. At one point, we were going to have another guest on the show. We had all these other hot topics. You had technical difficulties.
Girl.
What we made it work.
It was an amazing show. So.
And actually, I'm just glad we dedicated it to Dr. Chris Bustamante, because I think we learned so much. And it's one of those that you're gonna want to rewatch to take some notes on. So we thank you. Oh my goodness. Okay. You can follow my co-host Kodi. He's a life coach. Follow him at KMD Coaching on Instagram. KMD Coaching on Instagram, or his personal account at Mr. Maurice. Mr. Maurice. Follow me. I am _ Steve V. Follow our brand new show, Of a Certain Age Pod, POD, Of a Certain Age Pod. And Of a Certain Age Podcast is out now. You can get it wherever you get your podcast. The premiere episode with our special guest, Nathan Harrington, is out now. He's a life coach, and we're asking the question, are you where you thought you would be? And we're talking about career or life. And he gives a lot of tidbits, and it's just really exciting. I'm so
It's a
happy.
wonderful conversation.
And yes, super happy, super happy. In the meantime, thanks, virtual audience. Continue having hot, gay sex. Yes, lovely people. Oh.